But panic attacks are very real situations where someone has a sudden period of intense fear or discomfort that something bad's going to happen, and that there's some imminent threat or danger. These feelings are often so intense that they're accompanied by physiological symptoms like heart palpitations, dizziness, or shortness of breath. These symptoms peak within the first 10 to 20 minutes, but some might last hours. In order to be characterized as a panic attack, though, the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, or the DSM-5, says patients need to have an abrupt onset of 4 of the following 13 symptoms: pounding heart or fast heart rate, chest pain or discomfort, sweating, trembling, shortness of breath, nausea, dizziness, chills, numbness, feelings of choking, feelings of being detached from oneself, fears of losing control, and fears of dying. Panic attacks can happen in the context of several mental disorders, including depressive disorders, post-traumatic stress disorder, and substance abuse disorders. It can also, however, happen in the context of a panic disorder, which is basically defined by the panic attacks being recurrent, meaning 2 or more, and unexpected. In addition, the DSM-5 says that for somebody to be diagnosed with a panic disorder, they also need to have persistent worry or change in behavior because of their panic attacks. Also, the panic attacks can't be due to the effects of some substance, like an illicit drug or medication. Finally, the panic attacks aren't better explained by some other anxiety disorder, like agoraphobia or social anxiety disorder. Patients with a panic disorder can't predict where the panic attack will happen next, so it's important to get treated before patients develop something called avoidance, which is when they actively avoid the places where one previously happened. They might stop doing activities that they think might trigger the attacks, like going to the park, riding in elevators, or driving.